Hi, everyone, and welcome to Stanford Care's monthly Community Health Talk series. My name is Ariana Zhang, and I'm a second-year physician assistant student here at Stanford Medicine. I am pleased to bring you this series of talks co-sponsored by Stanford Care, Stanford Health Library, and the Vincent V.C. Wu Memorial Foundation. Today, I'm very pleased to welcome Dr. Tamiko Katsumoto, who will speak on the healing power of Asian diets, food as medicine in AANHPI communities. The question we'll be addressing today is how can traditional Asian diets help prevent chronic disease and promote long-term wellness? In this engaging talk, Dr. Tamiko Katsumoto will explore the protective power of food through an Asian cultural lens, highlighting the latest research on how traditional Asian ingredients, eating patterns, and cultural practices support health and longevity. Drawing from emerging science and ancestral wisdom, this discussion will focus on dietary strategies relevant to Asian American, Native Hawaiian, and Pacific Islander populations, including plant-based diets, fermentation, and mindful eating. Dr. Tamiko Katsumoto is a clinical associate professor in the Division of Immunology and Rheumatology at Stanford University and a board certified in lifestyle medicine. She is passionate about the role of sustainable, whole food, plant-centered diets in improving health and addressing climate change. Dr. Katsumoto studies the impact of diet and lifestyle on inflammation, autoimmunity, and cancer, and directs Stanford's Rheumatology Oncology Clinic. She also co-leads the Food Systems, Health, and Environment Working Group at the Stanford Center for Human and Planetary Health. With that, it is my pleasure to turn the program over to Dr. Katsumoto to begin today's talk.
First of all, thank you so much to the Center for Asian Health Research and Education. Huge thanks to Nina, Ariana, and the whole team. I've been just so impressed with your whole effort and happy to support this. So thank you for inviting me. So tonight we're going to be talking about food as medicine. And here's an outline of what I'd like to cover. First, I think we should all celebrate our rich Asian cultural heritage, a culinary heritage. And I want to spend some time talking about food as medicine, giving examples of how food really does heal many, many different conditions, and talk about some of the Asian specific health considerations. I do want to spend some time speaking about the changing landscape of food and our environment. And then finally, let's end with unlocking the healing power of food. Let's talk about some of the science as well as ancestral wisdom. And I want to leave you with some very practical steps, tips, and tricks towards moving towards an Asian heritage diet.
Yes, I'm so sorry.
What's that? Oh, okay. So let's jump in, starting with celebrating our rich Asian culinary heritage. So, food is such an important part of our culture. And as a Japanese American growing up, I remember always looking forward to New Year's, where there was this incredible spread of beautiful, colorful foods that was such a celebratory part of the occasion. We also know in Asia that food really represents family. And of course, here's a picture representing, how many dinners we're eating around a table, so many family gatherings, showing a beautiful picture of an incredible spread of a diverse variety of Chinese foods. And here are some of the most beautiful pictures of Korean foods and Native Hawaiian foods, Vietnamese and Indian. And I think what we can appreciate is just this diverse array of beautiful vegetables, fruits, different, beans, legumes, also some seafood. A lot of this is incredibly healthful food, which has actually led to longevity. When we think about looking at our world in data, this is a really very helpful website I encourage you guys to check out. And when you look at life expectancy, perhaps it comes as no surprise that some of the longest lived countries are the Asian countries like Hong Kong, Japan, South Korea, and Singapore, where the average age outstrips that of the United States. Longevity is obviously a very complex phenomenon, and many different factors play into longevity. And so there are other Asian countries that fall below the life expectancy for the United States, such as China, India, Indonesia, and the Philippines. So that being said, I think in general, Asian diets do tend to traditionally be very healthful, and there may be other factors that are playing into longevity in these other cases. So I want to kind of segue into food as medicine. This is something that I believe in very strongly. And as a background, I'm a rheumatologist, so I deal with a lot of patients that suffer from arthritis. I'm showing you a picture of rheumatoid arthritis as well as osteoarthritis. These are the two most common types of arthritis that we deal with. And I want to just highlight a study that recently came out done by our colleagues in the Netherlands called Plants for Joints. And what they did was a randomized controlled trial using a lifestyle intervention. They used a whole food plant-based diet where the patients received weekly menus. They had a lifestyle program where they had education about whole food plant-based diets, exercise, stress reduction, cooking classes, and physical therapy guided exercises. And in doing so, they randomized in the rheumatoid arthritis study, they randomized patients into a control standard of care arm versus the Plants for Joints lifestyle arm. And you can quickly appreciate that the disease activity score, based on 28 swollen and tender joints, improved quite dramatically and significantly, even as early as 8 weeks, and remained so at 16 weeks, this was even more pronounced in the seronegative rheumatoid arthritis group. I think what was even more surprising is that osteoarthritis, they did a study in osteoarthritis patients. This is one of the types of arthritis that tends to affect older adults. And what's really striking is, we don't have a lot of great treatments for this, but you can appreciate that in the Plants for Joints group, these patients got much better over a period of 16 weeks in terms of pain, stiffness, and function. So to me, these studies demonstrated that food is medicine and lifestyle medicine can be very, very effective. And if that's not enough to convince you of the value of lifestyle medicine, something that I personally am very concerned about, and I think a lot of us think about, is early Alzheimer's disease. And this was a study done by Dean Ornish and his group, where he did a randomized controlled trial looking at 51 Alzheimer's patients with mild cognitive impairment, early dementia. He randomized them into a standard of care arm and into a lifestyle intervention arm. And this comprised a whole food, minimally processed, plant-based, essentially vegan diet. In this study, they actually provided the meals to the patients. They also put the patients through aerobic activity 30 minutes a day, as well as mild strength training 3 times a week, stress management 1 hour a day that consisted of meditation or yoga or breathing exercises, lots of group support sessions 3 times a week, 4 hours each, and then some supplements. And what they saw at the end of just 20 weeks is they found there was a significant improvement in clinical global impression of change score, highly significant, clinical dementia rating, global score, which was significant, and even an objective measure, which was the amyloid beta 42/40 ratio that improved over the course of these 20 weeks. So, what does this tell us? To me, it says that lifestyle medicine can be incredibly powerful. And I like to tell my patients that a whole food plant-based diet, we can call it an anti-dementia diet. When we talk about lifestyle medicine, I think one of the 6 pillars that is most prominent is nutrition. And also, we have to factor in exercise, stress management, social support, sleep, as well as avoidance of risky behaviors and toxic substances. And we'll talk about that shortly. So, let's talk about some of the Asian health considerations. I think people are aware that there has been this concerning uptick in the global trend of obesity worldwide. And now the overall rate of obesity globally is somewhere around 14%, which has been going up since the 1980s and even before that. And of course, the issue is that obesity has many, many negative associations. We know that it's associated with hypertension, cardiovascular disease, hyperlipidemia, type 2 diabetes, fatty liver disease. What's maybe less known is that there are clear associations with several cancers. In fact, there are 13 cancers the National Cancer Institute has declared definitively associated with obesity. Some of these include breast and colon, endometrial, kidney cancer. We're seeing an uptick in endocrine diseases, things like polycystic ovary syndrome, hypothyroidism, infertility that have been associated with obesity. And finally, relevant to myself as a rheumatologist, we are seeing an uptick in musculoskeletal diseases like osteoarthritis, gout, even low back pain. So The bad news is that the United States is doing very poorly with our overall rate of obesity being about 42%. When you look at all the Americas, it's more like 22.5%. Europe's a little better. And the good news is that Asia is doing by far the best of all the different regions in the world. But that being said, even Asia is experiencing an uptick in levels of obesity over time that we can really appreciate. And what's happening in our Asian American community? So this is data from the Centers for Disease Control that shows that basically if you look at non-Hispanic white, non-Hispanic black, or Hispanics, on average, their rates of obesity are far higher than the rates of obesity in our Asian American population, which is again around the 40-45% range versus in Asians, it's about 17%. So Asians are really doing quite well relative to our other counterparts. But as I mentioned to you, when you think about the overall rate of obesity in Asia, which is only 5 to 7.5%, Asian Americans have a rate of obesity that's about 17.2%. So this is a problem that we also need to be thinking about. And one thing that I think many of you in this audience are familiar with, as I'm guessing you follow the CARE lectures, is that the problem with Asian Americans is that we may be lean, but we can still be unhealthy. There is a higher risk of metabolic syndrome that can occur at a lower body mass index in Asian Americans compared to non-Hispanic whites. And this is thought to be a function of the fact that Asian Americans and Asians in general tend to accumulate more visceral fat more easily than our counterparts, our non-Asian counterparts. And this is depicted, these are data from the NHANES database showing that at a lower BMI, the Asians have a higher risk of metabolic syndrome. So, for example, at a BMI of 26, the rate of metabolic syndrome in Asians is higher than it would be in non-Hispanic whites. So, this is a big concern that we need to be thinking about. And hence, again, obesity doesn't tell the whole story. So, we need to, again, be really thinking about how do we manage this obesity issue. So, I'd like to segue into the changing landscape of food and our environment, which is something that I care very deeply about. In terms of our landscape of food, one thing that many of you may be familiar with is the standard American diet. And we can just call this the sad diet because it is unfortunately quite sad. It looks very much like this, where we are seeing a lot of burgers and hot dogs and fries and pizza and chips and things that are, again, not healthy for us, soft drinks, things like that. And based on the dietary guidelines for Americans, what's very unfortunate is the percentage of people who consume the recommended daily minimum amounts of fruits and vegetables. In adults, it's about 12% consume the minimum daily amounts of fruit and about 10% vegetables. When you look at adolescents, these numbers, percentages, are in the single digit range. We are far from meeting the dietary guidelines for Americans. The standard American diet has really caused problems for us. And the problem with the sad standard American diet is it's high in ultra-processed foods, it's high in animal products, therefore it is highly inflammatory. I'm going to show you some data from the US Department of Agriculture, which shows over the past century, look at what's happening with the US per capita or per person meat intake. There's been a very clear upward trend where we're now eating about 200 pounds of meat per person per year. Look at the curve, the slope of this curve for US per capita chicken intake. And here's what we're seeing, a very steep upward increase of chicken intake, especially things like fried chicken. And look what's happening with cheese. Now we're eating about 37 pounds per person per year of cheese. So these are, again, to me, concerning trends. What's happening in Asia? So I was able to find some data from China where you can appreciate over the years, looking back to 1969 and moving forward, that you can see that the proportion of animal products that are being consumed has gone from about 6.7% all the way up to 23% more recently. So this uptick is concerning for many reasons. What about ultra processed foods? So the good news is Asian countries tend to have much lower ultra-processed food consumption as compared to, unfortunately, the United States, where we're close to 60%. But I think we can all agree that we are seeing invasion of boba shops everywhere. I don't think there's a lot of nutritional value in boba. Hate to say it. For those boba lovers out there, this is really a sometimes food. I think we're seeing grocery stores that are being invaded with a lot of these packaged, sugary and salty snacks that are ultra processed and very highly addictive. I have to put spam on there because ultra processed meats are actually considered a class one carcinogen by the WHO. So these are, again, probably foods that are very much sometimes foods and really not something we should be eating on a regular basis. So, why are these foods so problematic? I think that, we're hearing headlines about how ultra-processed foods, as well as, animal-based foods, are linked to higher mortality. And I think we're just starting to better understand the biology of what makes these foods so problematic. We are learning more and more about the wonderful gut microbiome. And our goal is that we want to have a very healthy, happy gut microbiome that has a great diversity of bacteria that really is important in helping to maintain a tight epithelial barrier, as well as a very nice, thick mucus lining. And this is the way that we protect ourselves from the outside world, and this is the way we keep inflammation at bay. Fiber is a key ingredient that is really important. Fiber, which is only found in plants, helps to feed these good bugs in our gut, and that helps to maintain this protective mucus barrier. A problem is if we have a diet that's low in fiber, we tend to get overgrowth of a lot of the gut microbiota that help to degrade this mucus layer. In addition to lack of fiber, oops, there are several other chemicals in ultra-processed foods, such as emulsifiers, artificial sweeteners, food colors, nanoparticles like titanium dioxide that's found in Skittles, which can actually cause the bad microbiota to outgrow. And emulsifiers are in particular problematic for degrading the mucus lining. And a lot of these chemicals can actually lead to inflammation and cause the epithelial barrier to become leaky. And this leads to systemic inflammation in our bodies. In addition, saturated fat and environmental toxins are also known to lead to a poor gut microbiome and more leaky gut, causing chronic inflammation. So it highlights the importance of good food in maintaining a healthy gut microbiome. What else are we seeing in our environment that's changing? So I'm showing you a graph of what's happening with US chemical production, and you've seen this steady upward incline over the past several years. We have now 84,000 different chemicals in circulation today. Only about 1% have actually been tested for safety, which is a huge problem. It turns out manufacturers are not required to disclose all of the ingredients in these products. And this correlates with a rise in a lot of chronic diseases that we're seeing. I want to just highlight a couple of articles, review articles that we recently published that may be of interest, where we talk about food as medicine, we talk about environmental risk factors, and gout, which is another condition that's on the rise. And I think one thing that I want to highlight for this audience in particular is that the World Health Organization states that about 23% of all global deaths have now been linked to the environment. And what's notable is that there's a preponderance of deaths that are happening in Asia. And I wonder if this is related to the fact that these, Asian countries, there's high levels of manufacturing and heavy industry that may be leading to more polluted environment. So it's thought that the environment may actually play a role in even up to 80% of our diseases. And a lot of these are chronic diseases that are associated with things called endocrine disrupting chemicals, or EDCs. We are seeing an uptick in reproductive issues and reduced fertility, male and female reproductive tract abnormalities, early puberty, obesity, type 2 diabetes, cardiovascular disease, neurologic, behavioral issues, thyroid disease, hormone sensitive cancers, and of note, impaired immune function and autoimmunity. So there's a lot of data that's becoming more and more clear that a lot of these endocrine disrupting chemicals may be underlying this increase in chronic diseases that we're seeing in our world. These are tables that are taken from the review that we just published. I want to highlight a few chemicals of concern, especially ones that are found in food. I think we should be asking what is in our food because we really are what we eat. So thinking about the antibiotics and hormones that are administered to animals that can be problematic, especially in the factory farmed animals that make up the majority, like over 95% of the animals that are part of the American diet. Methylmercury, we know that can accumulate in large species of fish. Polychlorinated biphenyls, PCBs. And the thing about a lot of these is that they are endocrine disruptors in blue, and they are predominantly found in more of the animal products because a lot of these compounds are fat soluble, so they tend to accumulate in fatty tissues, such as in animals and in our own adipose. Here are some other examples of chemicals that are all considered endocrine disruptors: dioxins and furans, organochlorine pesticides, PBDEs. These are the brominated flame retardants that are in our environment. And also, these all tend to accumulate in animals more so than in plants because of the nature of the fact that they are lipophilic. I want to highlight that some of these are also considered persistent organic pollutants. They stick around in our environment for decades. They're very difficult to get rid of. And so these present mounting threats that we need to be thinking about. So the goal is really to try to minimize our consumption of these chemicals. I'm going to show you some data where they looked at these PCBs, furans, and dioxins that are persistent organic pollutants that can be particularly toxic and concerning. And I'm going to highlight for you freshwater fish has been called out as a big risk, along with things like butter, very fatty. Human milk, believe it or not, can be a problem. Processed meats, and here's ocean fish, here's beef, chicken, and pork. Note that these levels are lower, but if you're eating them every single day, you can actually accumulate levels that are much higher, which is a problem. Here's dairy products. And then finally, they put in the vegan diet, which, by the way, has much lower levels of a lot of these persistent organic pollutants in them. I want to highlight a few more environmental chemicals of concern found in food. People have probably heard of bisphenol A, BPA. Here is a little schematic. These are plasticizers that help harden the plastic, and we know that BPA was taken out of baby bottles because it's a known endocrine disruptor. Unfortunately, BPA has often been substituted with something called BPS and BPF. So we need to be cautious about some of these chemicals that we're being exposed to. Phthalates are plasticizers that actually increase the flexibility of plastics, and also are known endocrine disruptors with higher levels found in fatty foods, especially in animal products. Perfluorochemicals are PFAS. These are the forever chemicals you may have heard about in the news, and these are also known toxins. They are all known to be endocrine disruptors, and in particular, the phthalates and PFAS tend to really be more higher levels in animal-based products, and the PFAS are the ones that can really hang out and last for decades, long period of time. So we need to be cautious of those. I don't want to be all Debbie Downer. I actually want to provide some hope because I think this is something that we're very interested in studying. There was a recent paper that came out in the American Chemical Society Journal showing that fenugreek and ochre polymers may actually help to remove microplastics from water sources. So I think it begs the question of whether consumption of this herb, and I think this is more common in the Indian culture, might fenugreek and might okra help remove plastics from our bodies? I think we need to do studies to kind of test that question. There was another study that showed that there's a potential protective role of anthocyanins in terms of mitigating some of the endocrine disruptive, reproductive toxicity of plastics. And anthocyanins are beautiful polyphenols that are found in a lot of the more colorful, the red, the blue, the purple vegetables and fruits. So maybe eating more of those might actually mitigate toxicity from some of these plastics. There was a nice review article that showed that actually dietary fiber may chemically adsorb some of these plastic fibrils. So is it possible that dietary fiber may actually help us excrete some of these microplastics? Again, these things need to be tested. And finally, I want to show you some beautiful data from an NHANES database study showing that people that had higher levels of fiber consumption ended up having lower levels of forever chemicals, PFAS, that were found in their blood, which I think is very interesting and exciting. And it makes you wonder, are these people eating more fiber, more plants, getting less PFAS from the food they eat, or are they possibly excreting it due to the fiber? Again, these are questions that need to be tested and vetted. So I think the key point here is, how do we protect ourselves from these toxins? I think the answer is going to be plants. Obviously, we want to avoid toxins as much as possible, but I think if we can increase our consumption of plants, these provide evidence to support detoxification of our liver. We'll talk about that shortly. The plants may increase antioxidants, and we'll also talk about some of the Asian foods that are particularly good for this. And finally, increasing fiber consumption that may help support the excretion of many of these toxins. So plants may be an important mitigation to our changing environment. And I just want to remind people, again, going to this wonderful website called Our World in Data, you can appreciate that plants have lower greenhouse gas emission levels as compared to animal-based products. And beef, particularly, is the biggest offender. And I know that we are dealing with issues like climate change. And I want to highlight a wonderful 10-minute video. If anyone's interested, please go to plateforplanet.org and check this out. It's a high yield 10 minutes of your time. So with that, let's jump in to unlocking the healing power of food. Let's talk about some of the science as well as ancestral wisdom. I think many of you have probably heard about blue zones. This is Dan Buettner, who has studied the longevity hotspots in the world, the centenarians. In particular, there are 5 different regions and now 6. Singapore was recently added, having the highest concentration of centenarians, people living to be 100 years old or greater. And one thing that was notable, in addition to a lot of other good lifestyle habits, the majority of these folks ate 95 to even 100% plant-based diets. So I think it is worth diving into what exactly do these blue zones diets, what were they comprised of? So I mentioned they were very predominantly plant-based, whole ingredients. One thing that every blue zone had is they tended to eat about 1 cup of beans a day. They drank mostly water, coffee, tea, wine in moderation. They had a handful of nuts a day, 1 to 2 handfuls. On a weekly basis, they limited their sugar, they limited eggs and fish, maximum of 3 times a week. And finally, they very much limited meat to about maybe once a week, dairy products also about once a week. And this Blue Zones diet pyramid looks very similar to the Asian dietary pyramid. I want to highlight this wonderful, wonderful website called Old Ways. And this is something that, again, is a great reference. I'm going to be speaking to it and referencing it a lot in our talk here. But the pyramid is a foundation of obviously good activity, social connection, enjoying meals with others. But here is the majority of where we want to spend our energy in terms of consuming good foods that are whole, vegetables, fruits, whole grains, legumes, nuts, seeds, soy, herbs, and spices. Every meal should be based on these types of foods, less so fish and shellfish, and less so eggs, poultry, and yogurt, and then really limiting meats and sweets less often. I want to share with you a couple of studies. So the Adventist Health Studies, these are some of the best nutrition studies out there where there was a prospective cohort of Adventists, over 100,000 people that were represented. And the key findings from them are that vegetarians tended to have lower risks of cardiovascular disease, hypertension, hyperlipidemia, diabetes, cancers, degenerative arthritis. And almost all of these risk factors and disease instances were further improved with a vegan diet. Here's also data from the Adventist studies showing the BMI as you became non-vegetarian, more and more vegetarian, and finally lacto-ovo and vegan, you can appreciate there was a stepwise decline in body mass index. Similarly, there was a stepwise decline in the prevalence of type 2 diabetes, with vegans having the lowest level. So many health benefits that I don't have time to go through, but decreased mortality, weight loss, cardiovascular disease improved, cancers decreased, decreased risk of diabetes and migraines, slower aging, so many benefits. We want to focus on fiber because we in the American diet are so deficient in fiber. And our goal should be 28 to 35 grams per day or more of fiber, which is incredibly helpful. It fills us up. Whole grain fiber helps to promote loss of calories in stool. It improves motility. You'll never be constipated again. It has beneficial impacts on our gut microbiome, and it improves our blood sugar response to food. I get asked the question about protein, and it turns out we really only need about zero point 0.8 grams of protein per kilo. So, really, about 54 grams for a 150-pound person, maybe a little bit more for older adults, for pregnant women, performance athletes, and children. But what you can appreciate is that there are lots of plants that can provide very, very quality levels of protein as compared to animal protein that has saturated fat and cholesterol in it. Um, I want to share some plant-rich Mediterranean dietary studies that were done in Asia. You can appreciate that in Japan, there was some systematic review and meta-analyses of prospective cohort studies showing a decreased risk of cardiovascular disease when eating a plant-rich Mediterranean diet. Similarly, in Singapore, there was a significant reduction in fatal stroke with higher Mediterranean diet adherence. Korea showed reduced insulin resistance, LDL cholesterol, decreased fatty liver in this randomized crossover trial. China, there was a study that showed there was reduced heart disease mortality with more legume, nut, and vegetable intake, and an RCT showing improved glycemic control in diabetics with a high fiber diet. And finally, in India, there was a very nice study showing there was a lower odds of diabetes with higher adherence to the South Asian Mediterranean diet score. So there is really good data in Asian countries that does support a plant-rich dietary pattern. I want to now finally end with how do we get towards trying to achieve this Asian heritage diet, which is really a plant predominant diet. So this is taken again from that wonderful Old Ways website. I encourage you to check it out. I think one of the important take homes is we really want to try to eat mindfully. And I think in traditional Asian cultures, it's so important that we enjoy our food with gratitude. We don't multitask when we're eating. We want to savor all the wonderful, rich flavors. And one of the concepts that actually is a Japanese term, hara hachibu, many of you have probably heard about this, is eat until you're about 80% full. It does take probably about 20 minutes or so for the body to have signals saying that, we are full, the leptin levels go up. And so I think it's important that we don't eat too quickly, that we really allow ourselves to savor and enjoy our food over time so we don't overeat. Eating lots of vegetables is super important. And remember, vegetables are high in fiber, and so that will help us feel more satiated. Using meat as a garnish. So, not saying that anyone has to go vegan. Please, if you do want to go vegan, that is obviously, associated with higher health. But I think that in general, using meat as a garnish is actually a very powerful strategy. There's something that my colleague and friend, Dr. Christopher Gardner, uses a term called the protein flip, where you end up using the meat as the condiment and making the vegetables and the plants, the beans, as the central attraction for your meal. Enjoy soy. There's a lot of benefits of soy. We're going to talk about them shortly, but there's so many amazing soy foods in our Asian cuisine that are just absolutely wonderful, that are just powerhouse superfoods that we should be eating more of. Fill up with hot soups. This is another strategy where soups may kind of warm us and get us feeling a bit more satiated, help to improve our digestion, help to control our appetite. And so there's a reason that soups are often served at the beginning of an Asian meal. Drink tea and water mostly. There's a lot of benefits of tea that we're going to talk about shortly. Green tea in particular has a lot of health benefits. Share meals with others. Again, thinking about mindful eating. Put away that phone, turn off that TV. Really think about eating with friends and family and enjoying good company. And that really will help with mindful eating. And then, of course, thinking about lifestyle medicine, we really want to make sure we emphasize physical activity. Things like traditional Asian exercises like Tai Chi or yoga are very important in building strength, flexibility. So, the Asian Heritage Diet, based on old ways, I love this website. Here are some of the foods that are recommended to eat often. Look at a lot of these wonderful vegetables and tubers that are, a lot of them are very Asian, like bamboo shoots and bitter melon. Daikon is a Japanese white radish. Things like lotus root, kombu is kelp, right? So I think people recognize a lot of these wonderful, wonderful foods that are in the Asian cuisine. Don't forget the purple sweet potatoes that was part of the Okinawan Blue Zones diet. Lots of amazing fruits that we have to choose from. In Asia, we have dragon fruit and kumquats, lychee, mangosteens, again, papaya. It's just amazing the array of wonderful fruits that are in our repertoire of food. Don't forget, these nuts, seeds, legumes are an incredible source of protein. Lots of wonderful seeds. Sesame seeds are particularly healthful. Lots of wonderful beans. Soy is sort of the king, but azuki beans, edamame, mung, etc., are very important. Lots of amazing herbs and spices. A lot of them actually have great medicinal properties. Here's fenugreek, we talked about, that may help us with microplastics. But lots of wonderful, wonderful, tasty herbs and spices that have great health benefits. And then finally, grains. The goal is to really try to increase whole grains and decrease refined grains. Sometimes foods. So, eating seafood in moderation, I think that we do, seafood can be very healthy, lots of omega-3s that are known anti-inflammatory agents. But I think we need to also be cognizant of what's happening in our oceans, in our waterways. The fact that, unfortunately, a lot of seafood is maybe not as clean as it once was. And so we need to also keep that in mind with our changing environment. Poultry, eggs, and dairy, these are also sometimes foods that are meant to be eaten in moderation. And then eating rarely, so try to limit beef and pork. These really should be kind of sometimes foods, very top of that pyramid. And then, of course, the sweets, right? There's so many yummy Asian sweets, but again, these are considered celebratory, sometimes foods that we should try to really eat in moderation. So let's go through some of the Asian superfoods. I think soy is one that deserves great mention. There are a lot of different forms of soy. I think people recognize the pods of the edamame plant. A lot of this, here's the dry soybeans, so many different forms, tofu, incredible fermented forms of soybeans that we'll be talking about. I love soy milk, especially soy milk that has been enriched with, fortified with things like calcium, vitamin D. Soy is one of the most high quality protein sources that we've got, so keep that in mind. It's got all essential amino acids. It's rich in soluble fiber. It lowers our cholesterol, reduces heart disease risk. There's soy isoflavones that are important in lowering our blood pressure and improving vascular function. Turns out that soy is a great source of calcium and vitamin K, which helps to fight against osteoporosis. Also, a great source of iron, magnesium, and B vitamins. May actually reduce cancer risk. And those who are dealing with menopausal symptoms, it may help to regulate a lot of our hormones and alleviate menopausal symptoms. So it's really important. I should mention that even patients with breast cancer, there's so much data with large meta-analyses showing that soy is actually protective against breast cancer. Don't forget, there's benefits of also a lot of other beans like mung beans, black beans, azuki beans as well. Bok choy and cruciferous vegetables. So these have been native to China. They've been eaten for over 1,500 years. Bok choy is a member of the cruciferous family. I'm showing a bunch of them here. Let's not forget broccoli, Brussels sprouts, radishes, cauliflower, kale, cabbage, turnips, a lot of these, collard greens. These are powerhouse superfoods. And the reason for that is not only are they full of fiber and vitamins, minerals, they have lots of really powerful antioxidants that help us with detoxification. And importantly, they are high in a class of compounds called sulforaphanes. And these are important for our liver to detoxify us from a lot of these chemical compounds and toxins that we've talked about. They are anti-inflammatory, an excellent source of the flavonoid called quercetin. They can lower our heart disease risk because they have high levels of folate, vitamin B6, and these are things that can lower homocysteine that's been associated with cardiovascular disease. These cruciferous vegetables can promote bone health. They're also high in calcium, phosphorus, iron, magnesium, vitamin K. And finally, these are anti-cancer foods. They are important antioxidants and they are, again, to help with detoxification that can protect against carcinogens. So really try to load up on these cruciferous vegetables early and often. Here's a nice little schematic speaking to the beauties of the wonderful health benefits of shiitake mushrooms that have that wonderful umami rich flavor. Lots of amazing compounds that are contained in mushrooms. And again, lots of wonderful redeeming qualities, antimicrobial, anti-cancer properties, antioxidant, anti-obesity, hepatoprotective, and immunomodulatory factors. Turmeric is also one of my favorite herbs and spices. It's been used for thousands of years in Ayurvedic medicine and traditional Chinese medicine. There's been a lot of benefits that are touted, such as prevention of diabetes. A lot of my patients have reported the anti-inflammatory impact where they have improved arthritis symptoms. This can be an anti-cancer agent, antioxidant. In fact, there's data suggesting it may help fight aging and Alzheimer's disease. I'm just going to point out maybe, make sure there's some caution if you're pregnant or nursing, have gallbladder or kidney problems, or bleeding issues. The safest way to consume turmeric is really as a spice that you put into your food so that you don't end up overdosing on supplements. But supplements are also, they can be very helpful. Green tea is one of the best things ever. I think that people are aware they are high. Green tea is very high in the flavonoid polyphenols, especially this one called EGCG. This is a catechin that is incredibly powerful as an antioxidant. There's data suggesting that green tea can lower the risk of several cancers. It may help to lower cholesterol and blood pressure to help prevent stroke and heart disease. Can improve bone density, may help with lowering blood sugar, and there's studies showing it may lower death risk from type 2 diabetes. What's exciting is green tea may help decrease risk of memory loss and benefit cognition, mood, and overall brain function. There have been many studies associating green tea with longevity, which is very exciting. I want to remind people that there are a lot of Asian whole grains we should be paying attention to. So I know, and again, I will confess, I too love white rice, but white rice has been stripped of a lot of the fiber and wonderful nutrients that is found in whole grains. So try to remember to incorporate some black rice and brown rice into your diet as well. Chapati, this is a whole grain form. Instead of naan, which is refined grain, chapati is another way of getting whole grain into your diet. Millet is a wonderful ancient grain that I think is gaining popularity, especially in India. Millet, I will mention to you, has higher levels of protein than regular rice, and really at higher levels of fiber. So millet is an incredibly, incredibly healthful grain that we should try to incorporate more into our diets. Soba, so instead of eating white noodles, really soba, buckwheat soba in particular, a nice whole grain option for noodles. And let's not forget about the power of fermented foods. I think that there are so many examples of great Asian fermented foods. Korean kimchi, I don't want to mispronounce, but Korean doenjang and gochujang, great examples of fermented foods. Japanese miso, Japanese natto, that takes a little getting used to because it's very pungent, but also very healthful. Chinese pao kai, and finally Indonesian tempeh. And let's not forget about kombucha. Kombucha and other fermented beverages are super healthful. There's so many food benefits there's so many benefits from fermented food that I can just highlight the antioxidant power, the fact that they are implicated in reducing blood pressure, cholesterol, anti-cancer, anti-diabetes. There was a beautiful study by Christopher Gardner and his group showing that fermented foods support a healthy gut microbiome. And what Christopher Gardner and Justin Sonnenberg showed is that high levels of fermented foods actually led to an anti-inflammatory effect. So these are very, very helpful foods, not to mention they've been implicated in helping with detoxification. So that was a very whirlwind tour. Thank you for sticking with me. I want to end with some take-home points before we do questions. I just want to highlight the fact that food really is medicine. And we have so many reasons to celebrate our traditional Asian heritage diets, which are very much promoting health and longevity. I think we have to recognize that our food environment is changing. And we spent some time talking about the standard American diet, which poses a big threat. We need to be mindful that, again, there's so much ultra-processed food out there. We're seeing an uptick in the consumption of a lot of heavy animal products that are problematic. We are also seeing that our environment is changing and that we do need to be thinking about some of these environmental toxins, including plastics and plasticizers, including persistent organic pollutants. And I hope that made the point that I think there's reason to be optimistic that eating a more plant-rich diet may actually be protective of a lot of these toxins. And planetary health is another thing. All these things are affecting our health. Fiber is something that I think is very important for supporting our gut microbiome and may also help with detoxification. Plants have many wonderful phytochemicals that support our health, promote longevity, and help with detoxification. Eating lower on the food chain is a very, very powerful mitigation strategy to support our health as well as support the planet. I mentioned to you that eating plants have a much lower greenhouse gas impact as compared to animal-based products. Minimizing ultra-processed foods is super important, which is also very important to support our health. So I just want to remind everyone to remember the steps that were highlighted in how we start to move towards the Asian heritage diet. Number one, let's try to eat mindfully. Remember the hara hachibu, eat until you're 80% full. Really eat a lot of wonderful vegetables. Use meat as a garnish. Don't forget about the protein flip, where meat becomes the condiment and the plants become the main attraction. Enjoy soy with great abandon. So many amazing soy products that we talked about. Fill up with hot soups as you start your meal. That's one strategy that's very helpful. Drink tea and water as your primary beverages of choice. And remember how many wonderful, healthful qualities the green teas and other teas have. Don't forget, share meals with others whenever there's an opportunity. The sense of bringing together community and eating mindfully is so important. And then, of course, let's be physically active. That helps with, again, everything with respect to lifestyle medicine. So I want to thank you all for your attention. I want to actually acknowledge my patients who have taught me so much about medicine, about food, nutrition, lifestyle. I want to say a huge thanks to Nina, Amy, Ariana, and the whole amazing Stanford Care team for kindly inviting me to do this webinar today. Neha Shah is a dear friend and colleague who practices food as medicine, has taught me so much. Christopher Gardner, who has the Netflix docuseries called You Are What You Eat. He and his team have been really important for my career. I'm very grateful. Thankful to family, friends, and my other colleagues and collaborators who've been very supportive. And most of all, I just want to thank all of you for your patience. I packed a lot of information in, so thank you for staying with me. And please follow me on LinkedIn because I do post a lot on these topics. And with that, I want to thank you all, and let's open things up to questions.